Bra Day is super important because prior to Bra Day and prior to other educational events where people were made aware of breast reconstruction, many patients didn't know that breast reconstruction was an option and that breast reconstruction by law needs to be covered by your insurance.
It gives awareness to not just women who have undergone reconstruction, but to women that are considering reconstruction and to women who aren't even aware that there is something like breast reconstruction.
The ability to put patients in contact with one another, to learn from each other, and to understand that there's a lot of joy out there despite what you're going through now.
Bra Day is important because I think it reminds people, not just patients but also providers, that we're not alone in all of what is happening and the care that we provide. And I think Bra Day allows patients to connect with one another and remember that they're part of a larger community.
Not a lot of women or people out there are aware of what options there are for breast reconstruction. Believe it or not, some women aren't even offered reconstruction at the time of their diagnosis and surgery, or just their circumstances, or not realizing that it's okay to care about how they look in addition to fighting the cancer.
We don't always get to follow up with the patients as frequently as we would like. It provides a great venue for former patients and soon-to-be patients to interact with each other, to see what life is like at the end or completion of their kind of breast cancer walk and breast cancer care. So for all those reasons, Bra Day is a special event, and I'm so glad that we are committed to doing it every year.
It showcases the reconstructive portion of things, which is, it's not only for aesthetics, it's to make women both feel whole again, both mentally, physically. There's a social aspect of it, and it just shows new patients and old patients just the importance of reconstruction.
Bra Day is really about increasing the awareness of breast reconstruction and how important it is to overall women's health. And I think events like this are really, really important because we're getting to be really good at treating the cancer. We need to also focus as much on life after cancer, and that's what breast reconstruction is about.
Plastic Surgery's annual Breast Reconstruction Awareness Day. This is the 6th year that we've done it. Obviously, this is a year we're doing it a little differently, but I can assure you it's going to be terrific. Could I have the next slide, please? So this is actually the 9th annual Breast Reconstruction Awareness Day. This was something that was started by our national organization in plastic surgery, the American Society of Plastic Surgeons. And it was designated to occur during the month of October, which is Breast Cancer Awareness Month. And the whole program was to really get the public word out about the importance of breast reconstruction in the total recovery of the breast cancer patient. And it was really our society and those of us who are very active in breast reconstruction. I'm not ready for the next slide. Can you go back? Go back a slide. Thank you. So it was a number of us, who are leaders in breast reconstruction, working with our society to get out the word that breast reconstruction is a very important part of closing the loop on the breast cancer patient, particularly patients, obviously, who have a mastectomy, but even some lumpectomy patients who we do a moderate amount of reconstruction on. And today's event is us, Penn Plastic Surgery, recognizing all of you, our patients. And this event is to celebrate with you your survivorship and to send out our support to new patients who are being diagnosed with breast cancer and that we will ultimately take care of. So this is for all of you, our new patients and all of our survivors. And thank you all for joining us. Could I have the next slide, please? So I got to say a personal huge thank you to Amy Klieger. Every year she is the driving force of Bra Day. She's from marketing. And she is more responsible for today's event because of the virtual nature of it than ever before. When we all meet in person, as we've done over the last 5 years, a number of other important people help Amy in this endeavor. And I want to briefly recognize them: Pam Keon from development, and the other 4 folks are all from Penn Plastic Surgery: Chris Gallagher, Carmela Cray, Anya Robinson, and Dave Akawa. Next slide, please. So today's Bra Day theme at Penn is about resilience in its many forms. And one of its forms is how we overcame a pandemic. We continued with a short moratorium. We continued to provide breast reconstruction to our breast cancer patients. And with no moratorium, we continued to provide care for our breast cancer patients, primarily in those 4 weeks when we couldn't do surgery through telemedicine. And really, this is about celebrating Bra Day together, us, you guys. It's in a virtual format. But again, Amy's done an incredible job here, and I think it's going to be a terrific event. Having said all that, it is my deepest hope that we will all be together face to face a year from now, and we are going to have one big Bra Day celebration. It'll beat anything we've done before. So keep an eye out for your emails and your calendars for next year's Bra Day. On the right of this slide is the program for tonight. We're going to start with 2 wonderful young people who have come up with a new educational model for new patients diagnosed with breast cancer. Throughout the program, you'll learn more about Penn Plastic Surgery team. We have a mother and daughter, Molly and Deborah, who are both breast cancer survivors, who were featured in the fashion show in February, AnaOno's fashion show, and they're going to share with us some thoughts. And then we're going to conclude with a panel discussion with Dana Donofree, who is the founder and CEO of AnaOno, and 5 of the Penn Plastic Surgery faculty. And it'll be a question and answer, sort of contemporary questions and hopefully contemporary answers in breast reconstruction. Next slide, please. So let me introduce these 2 wonderful young people. It's the first part of the program. It's Breast Reconstruction Awareness new educational portal. This was the idea and work of 2 terrific people, Tomi Famalusi, who is one of our outstanding 5th-year plastic surgery residents, and Liz Card, who is an equally outstanding 4th-year medical student who's applying this year in plastic surgery. Their endeavor was to create a new way to look at patient education and really improve in a very comprehensive way the education that can be provided for new patients diagnosed with breast cancer so that they fully understand in a much better way all of their options. So with that, I'm going to say goodbye for now, and I'm going to turn the program over to Tomi and Liz.
Good evening, everyone. My name is Dr. Tomi Famalusi. I'm one of the plastic surgery residents here at Penn Medicine, and I have here with me Elizabeth Card.
Hi there, my name is Liz Card, and I'm a 4th-year medical student at Penn.
So we're really excited to talk to you guys today about something we've been working on for about a year now. It's called PennBra, which essentially stands for the Penn Breast Reconstruction Advocate. And what this is a personalized online educational portal about breast reconstruction. And we created this to help patients understand their options for reconstruction, to essentially empower them to confidently discuss their preferences with their surgeon, and most importantly, to support them throughout the reconstruction and recovery process.
So this is going to be for any woman who has a diagnosis of breast cancer or who is at high risk for breast cancer, or any friends or family, or really just anyone who wants to learn more about the process of breast reconstruction.
Exactly. We understand that a diagnosis of breast cancer is extremely difficult, and this is oftentimes a really tough time in a patient's life. We also know that breast reconstruction comes with a host of options patients can easily become overwhelmed. What we wanted to do was provide comprehensive, but also very easy to understand, a very easy to understand resource of information about reconstruction. We also wanted to make sure that patients had ample time to learn about breast reconstruction before they came into their appointment so that they weren't overwhelmed, so that they had adequate time to digest that before coming in, saving the time that they're spending in the appointment with their surgeon for more nuanced questions about their personal care.
So now we'd like to show you the portal itself and go through some of the features. So what you'll do is you'll create a login, and you can access this on the web, so through your laptop or computer, or you can use it with a mobile platform, so iPad or cell phone. And you can access it at any point throughout the reconstruction process. So you can access it before your consultation appointment, afterwards, and even after your surgery and many years thereafter. And we'll go over a lot of different topics, including different options for breast reconstruction, so all the different surgeries, what to expect both before and after surgery. And there's also plenty of patient photos before and after reconstruction, as well as simple illustrations of the surgical options that you can pursue, and then some videos for how to do some of the post-operative care. We've also got a note-taking function that should be present on all the different pages, and we encourage you to take any kind of notes that might pop up, questions you might have, and then at the end, all of your notes will be gathered into one place, and you can print them out and actually take them to your consultation appointment and go over them with your breast surgeon. There's also a search function. So if you feel confident that you know all the different options for reconstruction, but you'd like to learn more for what happens during the recovery process, you can type that into the search bar and it'll take you right to the page that you're looking for. There's also a glossary, because we know that there's plenty of new terms and new things to learn. So for some of the vocabulary, you can just put your cursor right over that word and the definition will pop up.
So we're extremely excited about those features. The portal is currently available to a smaller group of patients. Those patients are involved in a research study in which we're determining satisfaction with the website and patient perception about shared decision-making about their reconstruction process. We're also looking at things like the time spent in the consultation appointment, whether or not this allows patients to have a longer discussion with their surgeon, or if it makes things much more concise and patients come in sort of knowing exactly what they want. So we're excited about what the results of the study will be. As soon as that study is done, then this will be available to the entire Penn Medicine patient population. That hopefully will be sometime in January. So we're really excited to share this with all of you. Our broader vision for this portal is to have it be available at the time of diagnosis for any patient within the health system. And we're hoping that this eventually becomes something that expands outside of Penn and becomes the standard of care for all patients in the country. We hope you are also really excited about what we've shared with you tonight, and we look forward to showing you what else there is to Penbra.
Thank you.
Thanks.
Today, more than ever, there are increased numbers of options for breast reconstruction. So I always recommend that patients think about all your options and spend some time weighing those options before making a final decision.
Bring a medical advocate with you because there is so much information provided, and I have to believe that only about 60% of what I tell the patient actually sticks. So if you bring an advocate, a loved one of some sort that can hopefully pick up that other 40%, it will make the appointment that much more enriched.
Seek an opinion of a plastic surgeon who's board certified and has done many of these procedures, to come prepared with questions and basically to get a general idea of what your options are and decide which option is best for you.
A lot of these patients are dealing with a new breast cancer diagnosis, so a lot of valid worries and concerns, and you're going to be in good hands, and we'll be able to address your questions when you come in, and set up a individualized plan of specific based on what the patient's goals are too, and kind of go through that plan with the patient, and then we become part of our team.
Reach out to the community of other breast cancer patients who have been through reconstruction. Also, Penn has a lot of resources, so getting connected with your nurse navigator in the Cancer Network is a great place to start.
Our ultimate goal of reconstruction is for you to be in clothing and for no one to know that you've had a mastectomy. So it's going to be somewhat of a journey and a process of accepting kind of the new you and being comfortable with that. Not getting overwhelmed by everything, and just kind of taking things day by day is something that's important.
If you can, find someone that has gone through this process, either a friend or family member, and see if you can get some insights into this. If not, read as much as you can about this and try and explore and find as much about your options, because thankfully there are myriad options now available.
My advice would be to stick with a long-term goal, to really focus on the long life that you have ahead of you, and looking at this as just a brief pit stop of the many joys that you'll have in the future.
Okay, who wants to go first? Should we do Nervous Nelly first?
Nervous Nelly.
Okay. Okay.
I broached the subject with my mom, and she said, "Do I have to be naked?" And I said, "Absolutely not." And she said, "Okay, I'll think about it," which was farther along than I thought I was going to get an absolute rejection.
So cute.
It was one of the most thrilling things I ever did, both in the moment, getting ready for it, the bonding with Molly, and the way it made me feel afterwards.
I'm loving this. I'm thinking, what kind of lip would you like to do? Like, what's your style?
I basically want to be J-Lo when I grow up.
Oh my gosh, yes, I love
Okay,
J-Lo.
yeah, so have fun.
Tell me a little bit about your story. I want to hear.
So, how familiar are you with breast cancer?
Not too familiar.
Get
So
ready for a
educate.
crash course.
Yes, I'm excited.
Okay, this is my mom. She's also in the show.
And my daughter Molly.
Yeah.
Generally, if Dana asks me to do anything, I say yes. It's sort of the nature of our friendship. And I'm 5'2", that I'm not really modelly looking, but I also...
I think you are.
But I also really stand by the philosophy. And I think really having had breast cancer cemented this for me, but that if something scares you, but it's not going to hurt anybody else, that it means that fear is telling you to do it.
1, 2, and then you'll walk away with the next one, okay? And then when we walk, you're just gonna step when I step. You're gonna walk with ownership, confidence, and grace. That's it. I'm not teaching you anything special. I'm just helping you to believe in you, and letting you know that I believe in you, and I know that you can do it. Now walk. Yes. Yes. Oh my gosh. Yes. That was good.
Having had breast cancer wasn't just about me. It's because my mom had breast cancer. I mean, that, was something that I'd grown up with as a little kid.
But the other thing that I think is really cool is that breast cancer was part of Fashion Week. To sort of say, I was in New York Fashion Week. It's like saying, oh yeah, and then yesterday I was an astronaut, but I decided, I had to come home and do the laundry.
When I walked down the runway and I got to the end of the stage and I sort of took off the jacket, as I felt the fabric coming down my shoulders, I felt just like a decade of shame just sliding off my body.
It really is, I think, a cause for celebration and appreciation, and also the way that Dana empowers so many women, including the two of us, and a chance to hang with you, hey.
Not a bad gig.
Yeah, really. Hi. So you didn't hear us talking about you, Dana Donofree.
Were your ears ringing?
Both are to you, our mystery guest.
I heard you guys might be talking about New York Fashion Week and the fabulous, fabulous people that you are and how amazing that was. For Molly and I, it was an instant connection from just seeing who I was at one point in time when meeting Molly, how afraid I was and how young I was. And Molly feels like a sister to me. And I just remember, saying to Molly for New York Fashion Week, I was like, would your mom walk with you? And, we were so nervous to ask. We didn't know if she would think we were crazy, if she would say no, or she would say yes. And I just found it to be one of the most beautiful moments. I mean, I come from a breast cancer history where I don't share that with anybody. I love you both so much. This is so not about me, and you guys have just totally brightened my day.
No, you created AnaOno.
One of the things that's so hard about cancer is that there's so much that you're afraid to say. And I guess, one way of thinking about the fashion show is that we got to say these things, which many people never get to say in their life. I mean, many people never even get to really tell people they love them. And then, in a sense, to celebrate that through the fashion show was really extraordinary, and just a great gift.
Really, it's my patients, being able to make them whole again and get them through a super emotional and difficult diagnosis.
The comparison of the first time I meet a patient in the office, then the last time I see the patient, and they're through this process, and the time that we spent together, being able to be a part of that process for these patients and getting to see them at the end of it is what keeps me doing this job.
In many ways, I'm hopefully having an impact upon women that they feel good about for a lifetime ahead. So it's the ability to have a one-on-one interaction with someone, but know that I'm treating a cohort of people that are going on to do great things.
I've always had a special place in my heart for breast cancer patients, dating back to medical school. I feel as if it's a bit of a calling to take cancer care or to take care of cancer patients. Having an understanding and a sense of empathy and sympathy for these patients and the life challenge that they are faced with. Having the capacity to be the reconstructive surgeon who has the opportunity to make things potentially better or even sometimes even improved. For all those reasons, I love doing breast reconstruction.
The satisfaction, that they give me, and the way that they are appreciative of everything that we do for them, really kind of keeps us going. And again, seeing that final kind of end result, of patients that are back to living their lives and being happy and comfortable.
When I was younger, my mother had breast cancer. She was 40 years old, and I was going through very early training in plastic surgery, and just seeing her undergo the transformation of having breast cancer, losing a breast, actually going without a breast for a good five years, and then undergoing delayed breast reconstruction, and how that changed her life really influenced what I ended up doing with my life and career, which is providing women with breast reconstructive options to help them feel more like themselves once again.
The thing that gives me the most joy is watching the patient go from devastated in your office dealing with cancer to a couple years out from surgery, feeling great about themselves, and to have had some part in that journey is so incredibly rewarding.
Wow, Molly and Deb, what a dynamic duo. Two very incredibly special people that I have the fortunate side to have in my life, but now you all as well. Welcome to our live conversation with Penn Plastic Surgeons on what's on everybody's mind, breast reconstruction and COVID-19. We all know it's been a year. Some of you are in treatment or ending your treatment. And today we're going to cover all of those COVID hot topics with the questions that you've sent in from the patients themselves. I'm Dana Donofree. I'm the founder and CEO of AnaOno. I'm also a 10-year breast cancer survivor. I'm excited to be here with Penn as part of my second bra day. And I have with me Dr. Serletti, Chief of Penn Plastic Surgery, Doctors Alexis Au, Paris Butler, Josh Fosno, and Lisa Wu. Very familiar faces to all of you, and we're so excited to have you here to help educate us and inform us on many, many different topics. So we're going to start first with you, Dr. Serletti. Let us know what the new precautions in place at Penn for plastic surgery, mostly with pre, post, and follow-up care, and how should patients be prepared and what to expect to come in during these new circumstances.
Sure. So let's break it down into pre-op, when the patient's in the hospital, and then what's happening post-op. So pre-op, every patient is formally tested for COVID within a couple of days of having their surgery. When they come in for surgery, they're screened in terms of symptoms and temperature, and then we obviously proceed with surgery. In terms of patients who are admitted to the hospital, I think it's important to know that fortunately the COVID census is quite small now. When it was larger, the breast reconstruction patients were put in a separate area far from where the COVID patients were. I think it's also important for patients to understand that every staff member, the people that they are going to be surrounded with in the hospital, are tested in terms of a questionnaire every morning. I have to fill it out, Lisa, John, we all have to fill it, the nurses have to fill it out. So we come into the hospital assuring the people at the door that we have no symptoms, we haven't been in contact. And while it's not 100%, 100% complete, it's as good as you probably can get. So I think the patient should feel that, in the hospital, all the patients have been tested and the people around them are screened. So I think it's as safe an in-hospital environment as you're going to get. And, it's sort of similar for post-op. For post-op visits, patients are screened with their temperature taken. They can't come into the office, certainly if they have a fever. So they're screened. And the same is true for the staff. I mean, the staff is similarly screened like I just talked about. So it's probably not perfect, but it is, I think it's an incredibly safe environment for us to continue to, provide care for breast cancer patients and provide for breast reconstruction.
I can only imagine the precautions in place, and thank you all for working so hard and diligently to keep us safe so we can continue on with our treatment. And I think that this is a great segue to start out with the future of breast reconstruction. I've been a patient myself for 10 years, and I will already say with breast reconstruction, I have seen so much incredible movement and new opportunities to reconstruct. But share with us what's actually in our new and coming future and what new techniques and technology is ahead.
Sure. So, I mean, the primary goal is always to improve aesthetics, the realness of the reconstruction, and to provide as prompt a recovery as possible. And I think there are two things that we've been doing. We spoke a little bit about it last year. One is sort of in terms of post-operative care, and the other has to do with sort of the technical aspects of the surgery. So in terms of the post-operative care, we have started this care project, which is Post-Operative Care Reimagined, which basically took your breast reconstruction patient who was coming in 4 or 5 times in the 6-week period into the office for wound checks, drain pulls, et cetera, and we moved this substantially to where the visiting nurse service comes to the patient's house, removes the drains. A lot of the communication is through telemedicine. This started probably about 2 years ago. And it really, we were better prepared. Penn Plastic Surgery was better prepared for this pandemic because no one had been using, or very few people had our experience in telemedicine. So this really helped us sort of get over the difficulties of limited patient contact because we were doing it already. And I think that, once we get over the pandemic, we'll continue to look at how to even streamline this better. The other thing that we've been doing over the last multiple years is to try to make our breast reconstruction sensate. We can have a beautiful looking breast reconstruction that looks incredibly natural. You do a nipple tattoo, but to the patient, it's numb. I mean, as we look at it, it looks like an A result. But for the patient, it may not, despite it being an A result, it just, because they can't feel it, it's a big missing factor. So, we have a large project going on where we've been trying to hook up nerves, make these sensate to improve to improve sensation earlier, and at the same time to try to improve the overall quality of the sensation. So those are sort of right now the 2 projects we're working on.
Really incredible. Absolutely 2 advancements that I wish I had. And I know I was a part of Bra Day last year, and just the in-home care is such a time saver and money saver for patients. And we applaud you for helping us get through all facets of our recovery. Dr. Fosno, this is for you. What advice are you giving to patients going through breast cancer treatment and surgery now?
That's a great question, Dana. And I thought about it a little bit today. I think the honest answer is I'm not sure I'm telling them anything differently than what I normally tell them, which is that the treatment of breast cancer is a process, and it can be a long process that has different stages. The first stage is learning, diagnosis, learning about treatment options, and sort of data, gathering. The second is enactment of a plan, deciding what type of surgical treatment you're going to have, additional treatment that goes along with that, and reconstruction and what your options are with that and how you're going to proceed. And then obviously the last is going through those steps, whether that includes surgery, chemo, radiation, and healing. And that process, every woman goes through at their own pace, goes through the adjustment to the new you, if you will, at your own pace. Some go through that quickly in the beginning, and some go through that toward the end. But that process takes time. And, during that period, there could be a lot of questions and a lot of thoughts and a lot of worry. But ultimately, it's about looking at the long-term goal. And that long-term goal is survivorship and leading a long, happy, healthy life. And yes, there's a lot of additional things going on in the world right now with COVID, and maybe that is another layer of complexity to what a cancer patient is going through right now. But that's all it is. It's a layer of complexity that you will get through. And what we focus on right now is that long-term goal.
Incredible advice. We know COVID is complicated, and so is cancer. So we appreciate having you guys there to support us all the way through. Dr. Awe, let's talk about breast reconstruction during COVID. Somebody asked that they're nervous about having their implant surgery done during this time period, and they want to know, is it safe for them to wait to have their surgery later, and for how long they can actually have their expanders in if they do decide to delay? Or is this even an option?
Sure. So I think it's interesting to talk a little bit about the past couple of months and how breast reconstruction's been handled since the beginning of COVID. So unfortunately, during the flatten the curve phase, we really were shut down for the most part. Almost all services in the hospital were kind of, geared towards taking care of COVID patients and making sure that there were rooms available for those patients and trying to minimize the spread. So for a couple of months, actually, women weren't offered the option of breast reconstruction. Once the hospitals reopened, the operating rooms have gotten back up to normal speed. So women are now able to have these different procedures, whether it's their initial reconstruction, the first step in their reconstruction, or the secondary, or sometimes the third or fourth stages of their reconstruction. And the hospital, as Dr. Serletti said, is a safe place. We are doing everything we can to make sure that patients, ourselves, and our staff are protected. So there's barriers at check-in, seats are spaced out, everyone's wearing masks. During surgery, a lot of surgeons are wearing 2 masks. So we really are trying to make it safe for our patients to undergo their procedures. And I understand that a lot of patients may not feel comfortable necessarily coming in. And I think there's 2 things I'd like to say about that. The first is addressing your initial question about expanders. If they've already had the first stage and they have their expanders in place, I don't see any harm personally in waiting a few months if that makes someone feel more comfortable. As I said, we are doing everything as we can now to make sure it's safe. Until a vaccine comes out, I don't know if the situation is going to totally change. So you could wait a few months. It may be the same in a few months. It may not. But expanders can stay in for that amount of time. They're not designed to be in for years, obviously. So at some point they do need to be changed out, but it's safe to wait a little bit longer if that makes someone feel more comfortable. So that's the first thing I'd like to say about breast reconstruction this time. The other thing I'd like to get out is that I think it's important that patients worry about COVID and not getting COVID and not spreading it. But I also think it's important that not just women, but all people still take care of themselves during this time period. So that means, if you feel a lump in your breast, calling your doctor, getting a mammogram. If you have an abnormality on your mammogram, going to the next step and getting that biopsied. Taking all those precautions and really taking care of yourself during this time really needs to be stressed, I think, as well as obviously avoiding getting COVID and minimizing the spread to others. So.
Thank you so much for that PSA. I'm sure everybody here is watching the news daily and nightly. We know breast cancer diagnoses are down currently, and such an important conversation right now is that you really cannot delay this treatment, especially if you've felt a lump. So thank you for that reminder. It's so incredibly important. Dr. Wu, let's jump over to you. If a patient does undergo an implant reconstruction, which is one of the top choices, what does screening look like after you have your implants?
So when you talk about post-mastectomy and reconstruction screening, there's really 2 issues. First, women are often concerned with either getting breast cancer recurrence or new breast cancer. So it's important to get to know your new breast, how they look and how they feel. Any changes should be brought up to your doctors. Second, if you have an implant-based reconstruction, women have to be aware of something called implant rupture. So your implant should last you a very long time, about 10 to 15 years. However, the rupture rate is 1% per year, so it can happen earlier. So as a patient, you may not be aware of a rupture if you have silicone implants. So it's important to stay in contact with your plastic surgeon. They can examine you and they can order either an ultrasound or an MRI to assess implant integrity. Just last month, the FDA released new guidelines for implant surveillance, and they recommend an ultrasound or an MRI at 5 years after reconstruction and about every 2 to 3 years after that.
Thank you, Dr. Wu. I will be calling you for my screening as I have been a bad patient and have not undergone those guidelines at all. So thank you for my own personal recovery. So there's a lot of discussion in the patient community on two very incredibly different topics. One being BII, which is breast implant illness, and another one being ALCL that can arise after textured implants have been in place. Can you briefly talk to the differences between these two topics and what patients should be on the lookout for?
Sure. Two very, very important, but two very different topics. So ALCL, start there, is anaplastic large cell lymphoma. It's a cancer that's associated with breast implants. It's important to know it's not a breast cancer. It's a lymphoma that is found in the fluid and the tissue surrounding the implant. Rarely, it can spread throughout the body. The risk of ALCL is very low. It ranges from 1 out of 2,200 to 1 out of 86,000 for women with textured implants. However, all women with implants could potentially be at risk for ALCL and should be aware of it. Symptoms typically are swelling of the breast, asymmetry of your breast, as in the two sides all of a sudden look different, a mass or pain of your breast. So if you experience any of these symptoms, you should really contact your plastic surgeon as soon as possible. BII, or breast implant illness, on the other hand, is not a cancer. It's a term that some women and doctors use to refer to a wide range of symptoms that can develop after a woman gets breast implants. Women typically describe fatigue, hair loss, rashes, brain fog, joint and muscle pain. It really can occur at any point with any type of breast implant. Surgery to remove the implants may or may not resolve all those symptoms. What it basically comes down to, take-home message is, should you have any issues regarding your implant or your reconstruction, it's best to get in contact with your doctors, who can then work it up appropriately and triage it. Thank you.
I definitely think that this is another even reminder from Dr. All as well. If you have any complications or you're faced with any questions, it's really best to call the office and schedule an appointment if one is so needed. Especially with telemedicine now, I'm sure you guys are also offering that as a benefit to patients, that they can you get the eyes on the problem and then you go from there. So thank you for laying that out for us and helping us understand. All right, Dr. Butler, it's up to you here. We've received a lot of questions actually about scarring post-surgery. Are we seeing any advancements in reducing scarring and or how to help it heal best?
Great question, Dana. Thanks for allowing me to participate. I will tell you that unfortunately, we have not come a tremendous way when it comes to scarring. Many of my colleagues will say that, the comment to the patient, there's no such thing as scarless surgery. The only scarless operations happen on a fetus. So we constantly comment on the fact that we're trading contour for incisions, and with that comes scars. Things that we can use to help mitigate those scars, and typically there's types of silicone gel. The most common one that most lay folks know is called Mederma. There's another one, if patients want to invest a little bit more money, it's called biocorneum. Done a fair amount of research on hypertrophic scars and keloids, and biocorneum had just come out about 10 years ago. And although, we were concerned in the beginning because they hadn't done head-to-head studies against, say, lotion with vitamin E or coconut oil or coconut butter, we believe now that there is something inherent about the silicone gel. In my opinion, it's the scar massage that's really imperative. So right around 3 weeks after their definitive operation is when I recommend to the patients using Mederma or biocorneum. They shower, they place about a dime-sized portion on their index finger, and then they rub those scars religiously for about a minute per breast, and they do that for about 60 straight days once your plastic surgeon says that your scar's ready. So really, scar massage, I think the change agent, regardless if it's lotion or the Mederma or the biocorneum, I think it's the persistent massage to break up and help remodel that scar.
Thank you for those tips. I also want to tap on not necessarily scar care, but ways that we can help mask the scars. And one of those is nipple tattooing. Can you talk a little bit about what we've seen, advancements from nipple tattooing, and who does it, and how do you even get started on that last final phase of the reconstructive process?
Another great question. So camouflaging the scars with tattoos, I think is a great way to do it, whether it's a standard tattoo. I have patients that have had tattoos from a tattoo artist of, a design that they've, always desired to have, or, a more traditional appearance of a nipple areola complex. And I would say that we've come a tremendous way when it comes to 3D tattooing. Now, not in my hands, and maybe some of my plastic surgeon colleagues around the country are doing them, but certified tattoo artists that are taking the time to take some additional coursework in nipple areola tattooing have really pushed the field forward. So much so that in our practice, we refer our patients out once we've finished the completion of creating their breast mound. We send them out. There are a couple of tattoo artists in the greater Philadelphia area that I send patients to. Mandy Sauer and the Sauer Institute has done a tremendous job for many years. I send patients there. I also send patients to a woman by the name of Jackie Brown. She's at Crescent Street Tattoo Parlor, which is in Manayunk. Unfortunately, the Women's Health and Cancer Rights Act, which was passed in '98, which mandated breast reconstruction on insurance providers if they were paying for the mastectomy or the lumpectomy or the additional oncologic care, they're mandated to perform or to cover breast reconstruction. There's a loophole, though, when it comes to nipple areola tattooing. So I'm trying to help our legislators, and Dana, you'd be happy to know that earlier this month, 3 congressional representatives just put out a new piece of legislation called the Comprehensive Breast Reconstruction Act that actually now incorporates 3D tattoo being performed by a certified tattoo artist as long as the prescription comes from a physician. So right now, those are our options. They have come a long way. I honestly, when my patients come to me and say, do I need a nipple sparing mastectomy or do I need a skin sparing mastectomy? I tell them that it doesn't really matter that much personally because the 3D tattoos have gotten so good. So hopefully that answers it.
That's incredible. And thank you for that hard work. We know that this should be a part of the reconstructive process. And with voices like yours behind it, we can actually see some movement. And you guys have done incredible. So I get a bonus question, which I would just be amiss to not reference that breast reconstruction can mean a lot of things to a patient. It can be an implant reconstructive surgery. It can be an autonomous flap tissue reconstruction. It can also be flat closure. Just remember, your first choice is no reconstruction at all. And there are options to visit and speak with the plastic surgeon to get cleaned scars and flat closure if that is something that you so desire. We also have incredible organizations here in our area for patient support, where if you're looking to speak to others that have undergone reconstructive surgeries that you're interested in, Unite for Her is an incredible local organization, as well as Living Beyond Breast Cancer and other support groups and social workers within the Aberson Cancer Center. So just wanted to throw that in there for all of you patients out there that might be verging on what decision might be best for you and your body. There is no wrong decision. Do what is 100% best for you and best for your treatment and care. So we do have a few minutes to answer a few questions from the audience. I'm going to pop into that. And please, docs, I will lead it all to you. I'm sure you'll know which expert is best to answer these. So one patient had a lot of lymph nodes under their arm removed 2 years ago and still don't have a lot of feeling. I'm unsure if that feeling is down the arm or in the breast. The question is will it come back?
Well, since I talked about sensation, I guess I'll answer that. It's amazing having seen patients over many years, and sometimes a patient will come in at 5 years out and have some very localized pain, particularly in the axilla. The axilla is the most common place where they'll get some localized discomfort. And what it is it's finally a nerve coming back. My experience is that whether it's a mastectomy site or a breast reconstruction, over about a 2-year period, people will start to get some sensation back. It never comes back to normal. But I think if you follow that out another 3 years, the sensation from 2 years to 5 years, I am certain improves to some degree. So the patient who sent that question, I think it's a matter of time and a little bit of patience.
Thank you. So important. This is a BRCA positive patient and looking to undergo their elective mastectomy later this year. We talk a lot about advancements with flap surgeries and flap reconstruction. Are there any advancements coming for implant reconstruction? Maybe now is a good time to talk about OTM versus DTM.
Well, Dana, I can comment about kind of my practice with implant-based breast reconstruction and how it's changed recently. So one way is we've heard about ALCL and how there's the likelihood of it being related to textured implants. A lot of times with implant-based reconstruction, we place expanders first. And traditionally, those expanders have also been textured. So one development is that implant companies have come out with smooth expanders so that hopefully we can avoid any texturing whatsoever. The second thing in my practice is that I've started placing expanders and implants in a pre-pectoral position, so in front of the pec muscle. Traditionally, they've gone under the pec because the pec muscle gives a little extra protection and coverage over the expander and implant. But I found that I've been able to place it in front of the pectoralis muscle, and that decreases the discomfort for patients as the expansion's being done, and also helps eliminate any kind of motion deformity. So when that patient lifts something heavy or flexes their pec muscles, you're not seeing the breast move. The final advancement is that during COVID, we've obviously tried to minimize patient stays in the hospital. Traditionally, after a woman had a mastectomy or bilateral mastectomies and expander placements, we've kept them overnight for pain control, for monitoring their incisions. During COVID, we've actually advanced to getting a lot of our patients home the same day after a mastectomy with bilateral expanders. And we've had great results with that. Patients have had very few complications, and most patients are incredibly thrilled to not have to spend the extra time in the hospital, and they get to get home and sleep in their own bed the night of surgery. So that's an advancement as well, I think, a positive that came out of COVID.
100%. I know that animation results, so I know there's going to be a lot of happy customers following that advancement. This is a fantastic question to end on before we jump into our final question. What about delayed breast reconstruction? I think this is first of all an option, but it's on the minds of a lot of people as they're going through their treatment. So Dr. Wu, can you jump in here and let us know, is that safe, and what should we be on the lookout for if we want to wait? And most importantly, will our insurance companies still cover us if we decide to wait?
Yes, so great question. As you said, very important. Delayed reconstruction is absolutely an option for most women who are diagnosed or are diagnosed with breast cancer and who are currently undergoing treatment. Doesn't matter if you had chemotherapy, doesn't matter if you had radiation, almost every woman has the option of having breast reconstruction after that. With regards to the insurance coverage, the Women's Health and Cancer Rights Act of 1998 made it a law that if a woman did get a mastectomy and insurance did cover the mastectomy, they are required to cover reconstructive options. So the woman should not have to worry about having to pay out of pocket or self-pay for reconstruction as long as they are covered by insurance. So very, very great question. My mom herself, she had breast cancer. She waited 10 years before she underwent reconstruction. And it really did change her life for the better. The quality of her life and feeling comfortable within her own body went up tremendously after she got breast reconstruction, and really, quite honestly, was the driving factor of me doing what I do today. So absolutely, come in and see your plastic surgeon.
What a beautiful story. Thank you for sharing that little personal side note. All right, so here's our round robin. Unfortunately, we've got to end all of this incredible information. Thank you guys so much for being there for us, supporting us, educating us. We really can't get through this without you, and I mean that from the deepest part of my heart. Dr. Fosno, let's start with you. Have there been any silver linings, and or what is your silver lining here with COVID and the world we've been in?
I mean, I think you can always find multiple silver linings, and I think I'll just stick with the one, predominantly that's work related, which is I think the introduction of telemedicine into our practice is going to have a wonderful addition to patient flexibility and the patient process down the road. I mean, I think we never really did a ton of it. This has opened up an opportunity for some simple post-operative visits to potentially be done via telemedicine, which saves patients many trips to the hospital. There's already a lot of post-operative visits for people that aren't always easy. And I think, juggling with childcare, work issues, going to doctor's appointments are not always the easiest endeavor. And so I think anything that we can do to make that more efficient for our patients is a win. And so I would say that's my work-related silver lining.
Well, thank you so much. Dr. Ah?
So I think I already mentioned my silver lining, which was work-related, was that for patients we're able to get expander patients home the same day after their mastectomies. On a personal level, I grew up with both parents who were physicians, and I understand, and as myself and all my partners, we really dedicate a lot of our time and ourselves to our patients and to our jobs. The one benefit personally during COVID was that I got to spend a lot of more time with my wife and my 2 kids. So it's time which I don't think we'll ever get to spend that much time together again, which may be good or bad, but I've really enjoyed that time with them. So that's a positive.
As long as it's a happy and healthy family, it's 100% fantastic. Dr. Butler.
Thanks, Dana. So for me, it's going to piggyback on what Dr. Fosno mentioned. I frame it a little different. So the silver lining from a work standpoint, a professional standpoint, is innovation and access. So a lot of my scholastic pursuits is on trying to help mitigate disparities in breast reconstruction. We know that there are 2 subsets of the community that don't receive breast reconstruction at the same rate as others. So those are our more seasoned ladies, so ladies over 50, and then our ladies of color. And I will tell you, before this webinar, I was on a breastcancer.org webinar with over 200 women of color, speaking about how we improve health literacy within these communities. So this technology of Blue Jeans and Zoom and Google Meets and Team Meets and what have you has allowed us to broaden our scope and broaden our reach.
Thank you for bringing that up, Dr. Butler. As we know, this is so incredibly important. Our Black and African American community members have a higher death rate than those of their white counterparts, and we've been working hard as a community to also help eradicate. And we appreciate you also bringing education and awareness to us in our treatment as a community as a whole. So thank you for that. Dr. Wu.
So I'm going to keep it personal. And so this time during COVID, as horrible as it has been, it has allowed me to concentrate 100% of my attention on my family, which unfortunately doesn't happen with a busy practice. The other thing it has let me done is I've been able to reconnect with those that are really important to me that I haven't been able to because of life. And it's been really, really good. So.
Thank you for that. It's an incredible opportunity to get to spend more time with our families. All of us busy people understand that now. A work-life balance can exist, potentially.
During COVID.
Only during COVID. All right. I wouldn't say that we saved the best for last, but Dr. Serletti, you bring us together every year and really give us education and support that we don't get all the time. So please share with us your last and final silver lining.
Sure. And then thanks, Dana, for doing this. You did a great job with this panel. So for our patients out there, you probably know that we're always taking pictures of you. And you might wonder, what the heck do they ever do with all those pictures they take? So, I had 15 years of unsorted pictures. And, I would go through it from time to time, particularly if I had a talk I had to give and I wanted to find some selective, pre-op and post-op pictures to show some colleagues at a national meeting. And I always kept promising myself that I'd get in here on a series of weekends and get through those pictures. And so what I did for those 4 weeks that we were off, I came to work every day, and it literally took me 4 weeks of getting through all 15 years of pictures. And I was able to sort them out: implant, lumpectomy, latissimus flaps, abdominal base preflaps. And two things happened. I found much better pictures that I've already populated into some of my talks, some of which are patient-oriented talks and some of which are doctor-oriented talks. But I can tell a much better story from an educational standpoint, having spent those 4 weeks every day. It took 4 weeks getting much better pictures. The other thing is I learned a lot. I looked at a lot of the patients and, I saw good results. I saw so-so results, and it really made me stop and think about, how we continue to do things better. So it was a very powerful 4 weeks of learning. So Dana, again, thank you very much. And Lisa, Josh, Alex, Paris, thank you. Another huge thank you to Amy. Amy, this was incredible. So this is going to conclude sort of the live portion of this. It's going to end with a brief video. Everybody, the patients out there, keep an eye on your email. We'll figure out fairly shortly the date of Bra Day for next year. And it is our deepest, deepest hope that we will all be together face to face to celebrate this. So good night, everybody, and thank you very much.
Good night.
Educational,
celebratory,
Exciting, energetic,
knowing your options,
strength,
It's interactive,
reassuring,
fun,
compassion, community,
togetherness.
Bra Day is empowering, fun, and inspiring.
definitely inspiring,
joyful,
beautiful,
empowering,
empowerment,
journey, amazing.
I think it's a time to sort of celebrate patients' achievements.
What I love most about my patients is that most of them are grateful for being a patient here in our practice and for having the option of breast reconstruction.
Cancer, breast cancer in particular, is a very emotional and difficult diagnosis. So I really love being given the opportunity to work with my patients through the whole journey from diagnosis to final stages and the final outcomes where they're cancer-free and completely reconstructed.
Love the fact that, and feel honored at the fact that they're willing to entrust in me with their care. I think it's a special bond, a special relationship. I tell the patients all the time that this is a team sport pertaining to their overall breast care. The fact that we are a big team and the fact that they have found me appropriate to be a member of that team is the thing that I am most honored by.
Their energy, their compassion, their strength going through a breast cancer diagnosis.
I meet my patients at the most dire part of their lives oftentimes, and then I get to see them throughout the process of treating the breast cancer and being cured of breast cancer oftentimes, and then seeing them at their best afterwards. The whole journey to health is what's important and what's amazing to go through with my patients.
But I'm constantly impressed by the strength that patients display as they go through it and the warmth that they extend to their fellow patients also going through it, and the support that they're always willing to provide.
For breast cancer, the vast majority of my patients are healthy women who are in the prime of their life, and this hits them like a ton of bricks. The resilience of getting through this, dealing with this on the short term, but then moving on with life in the long term, I think is very pleasurable on my end to be part of.
Their strength and their resolve. Every single day I get a chance to meet patients who are going through a really terrible part of their lives, and they do it with such grace and resilience. It really makes me it's very heartening to watch that happen.
All right, see you next year and be safe.
See you next year.